Hey, it's Roberto Miki again, and we've got another great video in our series of questions for the board and in-training exam reviews for any medical students, residents, or fellows who are studying for these exams. Well, good luck, and here's the exam question. Plug for the channel, hit like and subscribe and help out our channel so we can continue making these videos. In a patient who is unable to extend the thumb interphalangeal joint after a distal radius fracture, what is the most common type of injury? A. Open dorsally displaced extraarticular fracture. B. Closed non-displaced metaphyseal fracture. C. Closed displaced intraarticular fracture. D. Open volar Barton's fracture. Or E. Open Smith's fracture. Well, if you need some time to think about this question, pause the video at this time. So the important thing here is to recognize that when the patient is unable to extend the interphalangeal joint of the thumb, that means that the extensor pollicis longus tendon is likely been damaged or ruptured. The most common scenario in which the extensor pollicis longus tendon ruptures is a closed, non-displaced fracture of the distal radius. The mechanism by which this happens is not fully understood, but it is suspected that a combination of ischemia and mechanical abrasion are responsible for the injury. So the answer is a closed, non-displaced metaphyseal fracture. Well, hopefully you enjoyed the video, and we'll see you at the next one.